Hi, I'm Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'm going to talk to you about the risks and potential complications of an anatomic total shoulder replacement. So what does that look like? It looks like this. It's a total shoulder replacement. That indicates that both sides of the shoulder are replaced, not just the humeral stem, but also the socket or the glenoid. You can see here the little marker of the plastic component that is in on that side, metal component on this side. Now, when I'm talking to patients about a total shoulder replacement, the rehab is important to discuss. For me, that's typically 2 nights in hospital, 6 weeks in a sling, and rehab will take between 6 and 12 months. In terms of risks, what you need to know, this is a proper operation. It's like a hip or a knee replacement, and there are risks involved and that need to be considered. I would quote about 1% or less rate of infection, rate of dislocation is around 1% or less, DVTs, hematomas, all of those sort of little things can happen, like wound issues and so on. And there is a risk of nerve injury as well. Nerves do not like being pushed out of the way when we put a big piece of metal into the shoulder to replace it, and they can play up a bit, but it's very rare for that to be a long-term issue going down the track. There's also the anesthetic. This is a significant anesthetic. I will get you to be checked out by a physician preoperatively so that we identify and optimize any of those little medical issues. We want them sorted out before the operation. We don't want to actually discover them on table at the time. So that's very important. Now let's put some science behind that. There are 3 publications I'm going to draw your attention to. If you'd like to look at the publications themselves, just scan the QR code. It will take you directly to that scientific publication. The most significant, certainly for me, is the Australian Orthopaedic Association National Joint Replacement Registry report. The latest report is 2024. That is one of the big registries around the world, and it's one that everyone in the world looks at because it's such an important database. And out of that, at 14 years, there were 16,519 patients that have had a total shoulder replacement, including in that study, and everyone in Australia who has a joint replacement goes into that registry. Out of that, at 14 years, 17.5% of the shoulder have been replaced. So there's always that thing that these are mechanical constructs and they will wear out at some stage. So that's the number that we have in Australia. Now, of that group that have been revised, the reasons for the shoulder to be revised is rotator cuff instability, loosening and infection. 37% of patients were revised because their rotator cuff tendons gave way. 27% of patients were revised because of instability or dislocation. Loosening of the actual prosthesis itself was a reason for revising the prosthesis in 14% of those revision cases, and infection was a reason for revising the prosthesis in 15%. So it wasn't that 15% of the shoulder replacements got infected, it was that 15% of the patients that needed the shoulder revised, the reason for the revision was infection. Now, there's 2 other publications to look at. These are review papers. There's a review paper by Villicis in 2016. They looked at a hospital database, a total of 2,053 patients. They quoted an infection rate of 3.3%, an instability or dislocation rate of 2.5%, a stiffness rate, so loss of external rotation is usually the big issue there, of 0.58%, thromboembolic disorders, so pulmonary embolus, 2%, neurovascular issues, 0.24%, that's usually sort of nerve issues post-operatively, and mechanical or loosening issues in 3.6% of patients. Another paper to look at, Schoenweger 2024, 623 patients, quoted an infection rate of 1% and a risk of mechanical or loosening issues of 1%. So that's a good overview of the risks and potential complications of an anatomic total shoulder replacement, and I trust that gives you a better understanding of this issue. Thank you for listening.